This is Dr. Gossett with Lucille Finn. She's a patient of ours who has been treating the last couple of months, and she's 86 years old. Lucille, tell me a little bit about what kind of symptoms you were having when you first came in for care.
My symptoms were a backache that was unreal, and I mean really unreal. And I had, I knew I had to do something. And I came with my son, Tom, and I was very excited about going ahead with it. But then Tom was being overprotective, I felt. And so then I didn't come back, which I should have. I didn't realize that Dr. Gossett was really wondering if I was going to come back. I didn't, Anyway, I started going to Christie Clinic for help.
Did you go to the pain center there?
To the pain center, yes. And I had many shots in my back, and in different areas of my back, but none seemed to help. It was always supposed to be a time of relief after each shot, but none of them. So then finally, I can't remember what the last one was, but I can't remember what that was called, but it was supposed to be one that would really help. But
so
it
initially,
didn't.
were they giving you pain injections at local spinal levels?
Right.
And then were they recommending a spinal block?
Exactly.
Okay. Okay.
So then I did not go back to Christie Clinic, and I went to Carl Clinic, Spinal Center. And there, she asked me to bring all of the information from Christie, which we did. We brought everything to her, and then the next day I had an appointment, and I waited and waited, and immediately when she came in, she says, "Well, I'm sorry, but we can't help you." So then I asked her if there was any exercise or anything,
Physical therapy?
Any therapy. She said, "We have therapy, but it would be at night." So then I knew that I couldn't do that. So then I called Carl Advisory Nurse, and she had advised that I should go to my primary care and talk to him about it, which I did, and then I was referred to Carl on North Lincoln.
The physical therapy?
For physical therapy, and there I was in the water a lot, and it was wonderful, but it wasn't lasting. I still had the pain, and it didn't go away. So then finally I was so bad again, and I decided, I was really bad, because I knew that if I didn't do something, I would be in a nursing home. And I knew I wasn't going to let that happen, so I was determined. And my friend Teresa, she was always encouraging me, because Dr. Gossett really helped her. And I knew that he did, and still is. And so then here I am, and I'm glad I'm here.
Okay. So you were having neck pain, mid-back, and lower back pain that just wouldn't go away no matter what you were doing.
Exactly, yes.
You were having by the time I saw you the second time, you were having a lot of trouble with your balance. And
I did, and I was falling a lot.
Okay.
That was another, I was in the emergency room 2 times because of falling.
And if you remember, I told you, for people over 60 years of age, a complication of a fall is the most common cause of death over the age of 60. And you're well over that, so you can see how that could happen.
And now, after my decompression treatment, I no longer feel like my balance is bad. I don't feel like I'm going to fall.
Good.
I'm still very careful.
Yes.
But that's just natural to be that way.
Okay. Another problem I believe you were having was difficulty sleeping. So
absolutely.
you were on medication for that?
I could not sleep, and standing was really bad. And it's just like, but I'm just so glad I'm this far. I know I'm not through with my therapy here.
Okay. You were also, if I remember correctly, having difficulty thinking and processing and communicating. And
Exactly.
were feeling depressed.
I was having trouble with that.
So you were on medication for dementia at that time?
I was on way too much medication, and because of the pain. So consequently, that did, cause my memory and everything to be bad.
Okay. So you were on medication for your blood pressure, insomnia, and pain.
Right.
And then also
it was strong. It was hydrocodone.
Okay, that's a narcotic.
It's a narcotic, and I was on a lot of that. But I'm glad I'm off of it, and I just so I feel like I'm well on the way to recovery.
Good. Yes. You're through the initial phase, which is the spinal decompression and the acute therapy to get your pain under control and to get the spine stable. Now we're working on the neurology, which is helping with your balance now.
Right.
Your coordination and your balance and your clear thinking. And as time goes on, we're working with your flexibility and strengthening the muscles in and around your spine so that you have a scoliosis, and we're working on straightening and stabilizing that as much as possible.
Wonderful.
Yes. So during this time, you're experiencing some stiffness and soreness in these muscles that we're exercising, aren't you?
Right.
We're waking those up, and that's normal for them to be stiff and sore initially, but as we build them up, then they're going to feel good like the other side. Okay.
Yes, I'm glad to be here, and everybody is so good to me.
Thank you.
And especially Dr. Gossett.
Well, thank you. Appreciate that. It's a big investment of time, effort, and money. Would you say it's been a good investment for you?
Absolutely.
Okay.
It really has been. And Dr. Gossett has made it easy for me to make the payments, which has been wonderful.
Okay.
I really appreciate that.
Well, we try to be flexible with individuals and work within their situation.
That's great.
Would you recommend others make the investment of time, money, and effort?
I would. Okay. I would really recommend, especially elderly people that have given up and don't do it. There is a way to get well, It's worth trying. I would do it again.
Okay. So we want to thank Lucille for taking the time to share her story with individuals like you who may be in a very similar situation.